Okay, so this video is meant to address back pain and how it relates to the golf swing, mainly the stress that can be put on the lumbar spine depending on how you swing the club. So, start off, I've got Dustin Johnson on the left, who does not have a history of back pain, and I got Will Zalatoris on the right, who at the age of 25, I believe, has recently already had a double herniated disc issue that he had to have surgery for. So let's look at how they operate. Now, before I really dive in here, I just want to stress that this video is not meant to discuss functionality of the golf swing, or aka the ability to play good golf, because obviously both these players achieve that. But what I do want to focus on is injury prevention. So the first principle we want to talk about is early extension. And so that would be the concept of your butt coming off this line. So you can see for Will on the right, makes a nice takeaway, but there is very clearly a move off of that line. And you can sort of see his spine looks like it's in a tricky spot, and we're going to get into more of that in a second when we look at it from the side view. But here's DJ on the left. And again, when he came out, everybody was like, oh, this won't last. This swing is just hurts to watch, blah, blah, blah. And, you know, he's approaching 40 and he's still not having any back problems and just living his best life. So the difference is clear. Rather than moving off the line, you could argue he actually pushed a bit through it. So principle number one, early extension. DJ actually moved away from the ball or pushed back, whereas Will moved toward the ball. So let's look at that from a side view now and why that's relevant. So if we first take a look at DJ from both angles, doing things what I would call the safer way for your spine. And again, you don't have to be DJ to do these things, as we'll see. Let's watch the combo here. So we know that coming down, he does something to stay on this line. So from this view, let's watch what happens. So we're going to see that initial lateral shift. Knees actually get a bit wider, which is kind of a clue that he's not driving as hard from his trail side. There's still some lateral shift, of course, but most importantly, as we get to about here, we're going to watch that lead leg. It's almost like it's acting as a braking force, and we're going to watch this leg start to straighten and in a way push. We know it's pushing back this way and a little bit up as well for power, but most importantly, some good things are happening. The pelvis is staying balanced. He's not moving toward the ball. And from this side, he's not driving way ahead of the ball and having to lean back to hit it. A little bit of tilt is fine, but as we're going to see the difference in a minute here, this is a safer place to be. So the braking force he used, basically planting and pushing off his lead leg, acts to balance out his pelvis and protect his spine. You can even say he pushed hard enough that you can almost see his foot floating for a second. Now let's look at Will as the mechanism that has led to some back injuries. So to understand what's going on in his swing that's a little bit different, first thing to understand is that, you know, all good player, any player, when you wind up, you're going to turn your hips, 30 to 40 degrees, maybe a little more. But that's going to actually aim your two hip bones that way. So that's toward the ball and toward the target. What a lot of us have been taught to do, and I think what happens here is if you push aggressively off the trail side, you're going to drive yourself in that direction. And that's really like the main reason this happens. So, allows you to come from the inside. The issue would be if you get way ahead of it, you kind of have to tilt back to stay behind it, and that's what we'll see on the side here. So if we look at how Will's going to operate on his face-on view, right? Let's watch how that lower body acts compared to DJ. So here he goes, and boom. So at impact, we see clearly a more lateral shift. So he's through the line. You can almost see that the difference really is his ankle's been rolled. That's how much force there is pushing laterally forward. And then the compensation move is you have to lean back quite aggressively to stay in a position, especially with driver, to stay in a position behind the ball where you can hit powerfully up on it. And that little difference is adding quite a lot of pressure to the lumbar spine. I'm not a medically trained doctor, but I've been through this myself a bit, and I think a lot of medical experts on the spine would agree that that's going to add up over time. Putting that kind of lumbar extension while tilting and twisting, that's a tough place to be. So that little difference is what causes the pain. Injury, I should say. So the difference in how he propels and pushes off the lead side, the lack of braking force. Again, great release position, awesome golfer, going to win majors as long as he's healthy. The question is, will there be longevity swinging in this way? So to summarize, if a golfer pushes off their trail side but lacks the necessary braking force applied on their lead side, their center of gravity and their pelvis are going to get out of balance. And so the net result is going to be a lateral slide toward the target from this view. And from the down the line view, you're going to see that drift toward the ball, or that early extension. And in order for this golfer to get back into an effective hitting position, they're going to have to use their upper body, and they're going to lean their spine away from the ball and away from the target. And the trade-off there is going to be extra pressure on the lumbar region, which could lead to injuries over time. So that's my theory of causation for back pain in the golf swing. I will make some follow-up content to suggest how one could implement the concepts discussed here. But for now, I just certainly hope you got something out of this video, and I really appreciate you taking the time to watch.